Today we will cover what is a vaginal tear and my top pelvic floor strategy to prevent tearing. If you have not done so yet, hit the subscribe button and the bell to be notified every time I post a new video for active pregnant mamas. I've been working with active moms-to-be just like you for the last 10 years as a pelvic health physio in maternity care. And I have noticed that vaginal tearing seems to be one of the most common causes of anxiety in pregnancy. But what my clients report is that once they know what a vaginal tear actually is and how to prevent it, it relieves a lot of fear and it allows them to move past it and take action. I believe that knowledge is power, and if you do too, give this video a like and let's dive right into it. Let's start by going over what a perineal tear is. A perineal tear is when the perineum, which is the area between the vagina and the anus, tears as a result of the baby coming through the vaginal canal. A first-degree tear involves just the skin. A second-degree tear involves the pelvic floor muscles around the vagina. A third-degree tear involves a partial tear of the anal sphincter muscle here. And the fourth-degree tear, we're talking about a tear that goes right from the vagina all the way to the rectum. So it's a complete tear of the anal sphincter muscle here. 9 women out of 10 will be affected by a perineal tear, so it's quite likely that you will have some degree of tearing, especially if it's the first time you deliver a baby vaginally. In first-time moms, there is a 40% chance of having a second-degree tear and only 6% of having a third or fourth-degree tear. The third and fourth degree tears are really the ones that we want to avoid, and you can see that they're quite rare statistically. Now, if you want to look at the study I refer to, I will link it in the description below. Now, all degrees of tearing can be associated with postpartum pelvic health conditions like perineal pain and pain with sex. But when we experience third or fourth degree tears, it is more likely for these problems to happen. And on top of that, there is a 10% chance of having bowel incontinence in the first year postpartum when you have a third or fourth degree tear. And the reason for this is because, remember, in the third and fourth degree tears, the anal sphincter is affected here. So when I talk about bowel incontinence, it means that you have trouble holding your poop and you may have some accidents. It is quite embarrassing for people who deal with these symptoms, and it can cause a lot of anxiety in the day-to-day life, being out in public, right? Like just picture yourself being out at the grocery store with your little one and pooping your pants because you couldn't make it to the bathroom, right? I just can't imagine how that must feel. So, of course, we want to prevent these more severe tears as much as possible to mitigate the risk of developing these symptoms. Now, let's talk about stitching, because that's another fear that people mention is, am I going to be in pain when I get stitched? Now, with first-degree tears, your provider will assess if there is even an indication to stitch, because some of those tears don't even require stitching. But anything deeper than that, second, third, fourth degree tears, it will definitely require stitching for adequate healing. If you require stitching, your provider will freeze the tissues before doing so it's not something you should feel. And honestly, at that point, you will bond with your little one and that's all you will care about. I know it because I got stitched up after my birth and I don't even remember that part. It was all happening as I was lovingly looking at my beautiful son, and that's all I can remember, which is perfect. In terms of the healing, first and second degree tears are the most common tears, and they typically heal within a few weeks after birth and may not even cause any long-term perineal tear or painful sex issues. But any degree of tearing can be associated with these symptoms, and if they do, I want to reassure you that proper scar management and pelvic health physiotherapy are normally sufficient to get rid of these symptoms. And by the way, way, if postpartum care is something you're anxious about, I do provide postpartum pelvic health support in my online coaching program, which starts in early pregnancy. And I'll go over how to apply on my program at the end of this video if you feel like that would provide some peace of mind to be working with a professional through this journey. Now, some people are scared of feeling themselves tearing, but believe me, you will feel a lot of pressure down there when you give birth, whether you tear or not, and you will be so focused on pushing your baby out that you won't feel yourself tearing. So don't worry about that part. Like I said earlier, what we really want to prevent are the 3rd and 4th degree tears that involve the anal sphincter here, because those tears are more likely to cause long-standing issues of painful sex, perineal pain, and bowel control problems. So that's why we want to tackle them. Now, how do we prevent severe tearing, right? As a pelvic health physio who has worked with moms for over 10 years, I can tell you 100% that assessing for pelvic floor tightness in early pregnancy is the #1 thing I would recommend to you. Like any muscle in our body, your pelvic floor can be tight too. Did you know that? And a tight pelvic floor is more likely to tear during birth compared to a flexible and stretchy pelvic floor. If that makes sense to you, give this video a like. Sometimes people have been walking around with a tight pelvic floor their whole life and they don't even know, right? Because it's just something that's not very talked about. And if you don't have any symptoms from it, you've never seen a pelvic floor physio before, then how are you supposed to know, right? So what will happen is you will show up in the birth room with a tight pelvic floor that's not fit for the job it's supposed to do, and you will be trying to push your baby out against a tight muscle that does not want to release and open. So then what? It's going to tear, right? Or maybe you'll need assistance to get your baby out using forceps or vacuum, possibly an episiotomy. And these interventions are associated with an increased risk of having a 3rd and 4th degree tear. So if we act preventatively and make sure our pelvic floor muscles are in the best possible shape to allow your baby to come through easily, then we're starting to have an impact on our birth and recovery outcomes. In my online coaching program, I teach my clients right from early pregnancy how to self-assess if they might have a tight pelvic floor and what to do about it so they can be ahead of the game in preventing severe perineal tearing, and also, set themselves up for an easy recovery after birth, including an early return to an active lifestyle. Because my philosophy is if we prevent birth injuries, then we can bounce back faster after birth. Does that make sense? And honestly, I hear all the time from my clients how the program has empowered them to take control over their birth and recovery outcomes, and how they would have never known, hadn't they been in the program, how to assess if they had a tight pelvic floor and what to do about it. If you're ready to take action, we are opening some spots in my online coaching program, so I would encourage you to send your application through the link in the description below. And just so you know, we only accept active moms-to-be who are in their 2nd trimester. Now, if you'd like to hear more about how I got away with minimal tearing despite giving birth to a baby over 9 pounds, be sure to watch this video next. I will put the link in the description below. Thanks for watching.